The doctor said, "You're exaggerating, it's just stress," and sent me away without examining me. I left quietly. Hours later, he had a heart attack, and his career was over? Hi everyone. If you're subscribed, let's dive right into this story. This story will definitely drive you crazy, but don't worry, justice will be served in the end. Are you ready? Let's get started. Don't forget to hit that like button. I love reading your comments. I'm Daniel, 42 years old, and I work as an accountant in Portland. I've always been health conscious and careful about cardiovascular health because my family has a history of heart disease. My father died of a heart attack at 58. This story involves Dr. Richard Hoffman, a cardiologist at Portland General Hospital. He's in his late 50s, has been practicing for over 25 years, and has a reputation for being brilliant but arrogant. He believes his experience makes him infallible and doesn't appreciate patients questioning his judgment. What happened between us would ultimately end his career. It started on a Tuesday morning. I woke up with chest pain that extended into my left arm. Initially, I thought it was indigestion, but as the morning progressed, the discomfort got worse. I started feeling short of breath, nauseous, and had cold sweats. By noon, I was genuinely worried. Given my family history and the symptoms I was experiencing, I decided to go to Portland General's emergency room. I arrived around 1 p.m. and explained my symptoms to the triage nurse, mentioning my family history. She seemed appropriately concerned. "Your blood pressure is elevated, and your pulse is irregular," she said. "We'll get you back to see a doctor as soon as possible." The nurse who took me to an examination room was thorough and professional. "The doctor will be with you shortly. I'm going to get an EKG set up," she said. About 20 minutes later, Dr. Hoffman walked in. He was tall, gray-haired, and carried himself with arrogance. He barely looked at me as he flipped through my chart. "So you're having chest pain," he said dismissively. "Yes, it started this morning and has been getting progressively worse. I also have shortness of breath, nausea, and I'm sweating. My father died of a heart attack at 58. Dr. Hoffman finally looked at me, but his expression was dismissive. "How old are you?" 42. "Young men your age don't have heart attacks. What you're describing sounds like anxiety or stress. Have you been under any unusual stress lately?" "Some work pressure, but these symptoms feel physical, not psychological." "Mr. Thompson, I've been doing this for 25 years. I can tell the difference between a heart attack and an anxiety attack. What you're experiencing is stress-related." I was surprised by his quick dismissal, especially since he hadn't performed any examination or looked at the EKG the nurse had set up. "Doctor, given my family history and these symptoms, don't you think we should run some tests to rule out cardiac issues?" Dr. Hoffman became irritated. "Are you questioning my medical judgment? I'm asking for tests that seem appropriate given my symptoms and family history. I don't need tests to diagnose anxiety. The EKG the nurse set up is unnecessary. You're a young, healthy-looking man dealing with stress. You're overthinking this." Dr. Hoffman hadn't touched me, hadn't listened to my heart, hadn't checked my pulse, and hadn't even looked at the EKG machine. "Could we at least run the EKG that's already set up?" "Mr. Thompson, you're wasting hospital resources and my time. You're exaggerating symptoms caused by stress. Go home, take some deep breaths, maybe see a therapist. Stop being dramatic about normal stress responses." He handed me a discharge sheet listing my diagnosis as anxiety disorder. "Next time, consider whether your symptoms actually warrant emergency medical attention before coming to the ER." I sat there processing what had happened. A doctor had diagnosed me with anxiety without any examination, dismissed my family history, and refused basic tests. The nurse who removed the EKG leads looked uncomfortable. "Doctor's orders," she said apologetically. When I asked if my symptoms warranted an EKG, she hesitated. "I'm not allowed to contradict doctor's orders, but if it were me, I'd want the EKG." I left feeling embarrassed and confused. A doctor with 25 years of experience had told me I was fine, so I tried to convince myself he must be right. During the 20-minute drive home, my symptoms seemed to improve slightly. Maybe Dr. Hoffman was right. Maybe knowing a medical professional had evaluated me was enough to reduce my anxiety. I got home around 3:30 p.m. and tried to follow his advice about stress management. I made tea, sat down, and tried breathing exercises. For about an hour, this seemed to work. But around 5 p.m., everything changed. I was trying to eat dinner when the chest pain suddenly intensified dramatically. It went from a dull ache to someone squeezing my chest in a vice. The pain radiated down my left arm and into my jaw, and I was having difficulty breathing. This was overwhelming physical pain that made it difficult to think clearly. I tried to call 911, but was having trouble speaking due to the pain. "Sir, are you experiencing chest pain?" the dispatcher asked. "Yes, severe, can't breathe. We're sending an ambulance immediately." I managed to unlock my door and collapsed on my living room floor, where paramedics found me 8 minutes later. The paramedics immediately recognized I was having a cardiac event. "Sir, we're seeing clear signs of a heart attack," one said as they attached monitors. We're getting you to the hospital immediately. I was at the hospital this afternoon, I managed to say. Which hospital? Portland General. Dr. Hoffman, said anxiety. The paramedics looked at each other with frustration and anger. During the ride I heard one radio ahead. We have a 42-year-old male experiencing acute myocardial infarction. Patient was seen and discharged earlier today with a diagnosis of anxiety. Current EKG shows significant ST elevation. When we arrived at Portland General, I was rushed to the cardiac catheterization lab. Dr. Jennifer Wong, the interventional cardiologist, quickly explained what was happening. Mr. Thompson, you're having a significant heart attack. We need to perform an emergency procedure to open the blocked artery. You're going to be okay, but we need to work quickly. As they prepared me, Dr. Wong asked about my earlier visit. The paramedics mentioned you were here earlier. Dr. Hoffman said anxiety wouldn't do tests. Dr. Wong's jaw tightened. We'll discuss that later. Right now, let's fix your heart. The procedure took 90 minutes. They inserted a stent to open the blocked artery. Dr. Wong explained I'd had a widowmaker heart attack, a complete blockage of the main artery. If you had waited much longer, this could have been fatal, she said. You're very lucky. While I recovered, Dr. Wong and Dr. Stevens, the chief of cardiology, came to see me. We need to ask about your earlier visit with Dr. Hoffman, Dr. Stevens said. I told them everything, how he dismissed my symptoms without examination, refused the EKG, and diagnosed anxiety based solely on my age. Did Dr. Hoffman perform any physical examination? No, he didn't listen to my heart, check my pulse, or look at the EKG machine. Dr. Stevens and Dr. Wong exchanged concerned looks. What Dr. Hoffman did represents serious medical negligence. Your symptoms warranted testing. An EKG would have shown the abnormalities that led to your heart attack. Could it have been prevented? Proper evaluation this afternoon would have identified the problem and allowed us to treat it before you experienced a massive heart attack. Over the following weeks, I learned about the hospital's response. Dr. Stevens kept me informed about their investigation. We've reported this to the state medical board and initiated a formal investigation, he said. The hospital reviewed security footage and medical records. The contrast was stark. Dr. Hoffman had spent less than 5 minutes with me and performed no examination, while the emergency team immediately recognized my condition. The EKG finally run during my second visit clearly showed cardiac abnormalities that had been present during my first visit but were never detected because Dr. Hoffman refused the test. This EKG would have immediately identified your problem if run this afternoon, Dr. Wong explained. The investigation revealed this wasn't Dr. Hoffman's first negligence complaint. Several previous patients had complained about his dismissive attitude and reluctance to order appropriate tests. 3 weeks later, Dr. Stevens called with an update. Dr. Hoffman's employment has been terminated. The state medical board has suspended his license pending review. My case prompted the board to review dozens of his previous patients, identifying several other instances of questionable judgment. Your complaint may have prevented other patients from experiencing similar negligence, Dr. Stevens said. Dr. Hoffman never practiced medicine again. Within a month of my case, the state medical board's investigation revealed a shocking pattern of arrogant, dismissive behavior spanning over a decade. They uncovered at least 12 other cases where he had refused basic diagnostic tests, dismissed patient concerns without proper examination, and made dangerous assumptions based on age or appearance. One case involved a 28-year-old woman whose stroke symptoms he dismissed as hysteria. Another was a 35-year-old man whose appendicitis he diagnosed as gas pains without any physical examination. In each case, patients had suffered preventable complications because of his refusal to perform standard medical procedures. His medical license was permanently revoked, making him unemployable in any medical capacity. The once prestigious Dr. Hoffman, who had spent 25 years building his reputation, saw his entire career destroyed in a matter of weeks. Portland General Hospital took immediate action beyond just firing him. They implemented comprehensive new protocols requiring all chest pain patients to receive mandatory EKG testing within 15 minutes of arrival, regardless of age, appearance, or the attending physician's initial assessment. No doctor could override this protocol without approval from 2 department heads. The hospital also created a patient advocacy program, allowing patients to request second opinions or additional testing without fear of retribution from attending physicians. They even posted signs in examination rooms encouraging patients to speak up if they felt their concerns weren't being addressed. I filed a medical malpractice lawsuit that the hospital settled for a significant sum, acknowledging that Dr. Hoffman's negligence had put my life in immediate danger. But more importantly, the case set a legal precedent that helped other victims of medical arrogance pursue justice. The lawsuit revealed that Portland General had received multiple complaints about Dr. Hoffman's bedside manner over the years, but had dismissed them as personality conflicts rather than recognizing them as warning signs of dangerous medical practice. The settlement required them to implement better systems for monitoring physician behavior and responding to patient complaints. My physical recovery went smoothly, but the psychological impact was significant. I had trusted a medical professional who nearly killed me through negligence and arrogance. This experience taught me several important lessons. Trust your instincts about your body. Don't be afraid to demand appropriate care, and age doesn't determine medical risk. Dr. Hoffman's career ended because he let arrogance override medical judgment. He assumed his experience made him infallible, and that patients couldn't understand their own bodies. His negligence didn't just nearly kill me, it revealed a pattern that had been putting patients at risk for years. Sometimes the most dangerous medical professionals are those too proud to admit they might be wrong or to perform basic tests that could save lives. Have you ever had to advocate for yourself against a dismissive medical professional? Share your story. Speaking up in medical situations can literally be life or death. Don't forget to subscribe for more stories about standing up to arrogant professionals and trusting your instincts when something doesn't feel right.